This is the Lab Doctors channel, and I am here to enlighten you more on sickle cell disease. So I entreat you all to subscribe to this channel, like, share, comment, and let's do this together. So sickle cell disease is an inherited disorder that affects a lot of people. It is either inherited from the father or from the mother based on their HB genotype. So sickle cell test is a test done to investigate a sickle cell disease or a sickle cell trait. So when you're talking about sickle cell disease, then we are talking about the shape of red blood cells. So the normal shape of a red blood cell is biconcave disc in shape, and then a lasting days of 120. And because they are normal, they are so flexible, and this flexibility enables them to move smoothly or they navigate easily through blood vessels without any obstructions. And so, when someone is suffering from sickle cell disease or has a sickle cell trait, what it means is that the person's red blood cell shape is sickled. Someone will say crescent moon. So it's like this or like this instead of the normal red blood cell shape. Okay, so the biconcave disc shape of a red blood cell, which is the normal shape of a red blood cell, makes the red blood cell flexible. So it enables it to navigate or move through blood vessel very easily. But if one red blood cells are sickled, it loses that property of flexibility. And so moving through blood vessels become very difficult. And also note that sickle cell disease patients have abnormal hemoglobin, and also their red blood cells are not able to last for 120 days, which means they break down before the normal 120 days of a normal red blood cells. This situation puts them in a condition where they always need blood transfusion to save the situation. Okay, let's look at some of the complications that sickle cell disease or traits go through. They go through pain, they are sometimes or mostly anemic, fever, infections, and then delay in growth. The only remedy is bone marrow transplant. And bone marrow transplant is very expensive, which most people cannot afford. The little advice I would like to give is that make sure you know your sickling status. And after knowing your sickling status, further go in for HB electrophoresis. HB electrophoresis is a test or is a further test that is done to detect your genotype, to know whether you are A, you are AS, you are SC, and then many other more. This is the whole overview of a sickle cell disease or a sickle cell trait. So I entreat you all to like the Lab Doctors channel, subscribe, share to a friend to get this information. And please watch the video on HB genotype. You will love it. Till we meet again. Thank you.